Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Health Ministry issues advisory for healthcare workers managing COVID, non-COVID areas in hospitals. State Cabinet's meeting on the report of Tuensang fiasco remains inconclusive. COVID-19 recovery rate reached 63% in Nagaland after 16 more negative tests. And Nagaland Government issues standard operating procedures for special categories of people entering Nagaland. Health Ministry has issued an advisory for managing healthcare workers working in COVID and non-COVID areas of the hospitals. The Health and Family Welfare Ministry said an infection control officer cum nodal officer will be identified by each hospital to address all matters relating to healthcare-associated infections to prevent and manage the COVID-19 infection among the healthcare workers. The nodal officer will ensure that healthcare workers shall use personal protective equipment as per their risk profile while on duty. All healthcare workers managing COVID-19 cases are being provided with chemoprophylaxis under medical supervision. Healthcare workers have been asked to use appropriate PPEs during their duties, and any breach in PPE and exposure should immediately bring into the notice of the nodal officer of the department. It is recommended that pregnant, lactating mothers and immunocompromised healthcare workers shall inform their medical condition to the hospital authorities to get them posted only in non-COVID areas. It is advised that all healthcare workers must report every exposure to COVID-19 to the concerned nodal officer of the department immediately. Chief Minister Nipirio today said that the Cabinet had studied the report on the Judicial Inquiry Committee on the Tuensang fiasco. Talking to some media persons, Rio informed that the Cabinet had asked the Eastern Nagaland Legislators Union, ENLU, to meet the ENPO to discuss the report findings and recommendations. Following the submission of the report by the Judicial Inquiry on June 16th, the Cabinet had a closed-door meeting in the office of the Chief Minister at New Secretariat, Kohima. As the meeting remained inconclusive, another meeting has been fixed for June 20 at Kohima. Regarding the imbroglio between the NHM employees and the Department of Health and Family Welfare, following the regularization of the 27 newly appointed contractual doctors, Rio maintained that issues should be brought in a comprehensive manner and not in piecemeal. Rio further said that with the government's intention to upgrade the healthcare for public throughout the state, it is prepared to create posts for doctors and nurses and other supporting staff as well. The Chief Minister said that he had asked the Health and Family Welfare Department to give a comprehensive report on the NHM issue. Nagaland recovery rate of COVID-19 has reached to 63% after 16 more patients were tested negative of COVID-19 in their second test. Health Minister S. Pamyopam in a tweet this evening said 9 are from Dimapur, while 7 are from Kohima. Earlier, the minister also informed that 5 new cases of COVID-19 have been reported out of 320 samples tested, 2 cases each from Mon and Kohima quarantine centers and 1 from Dimapur quarantine center. The state has now 198 total cases, out of which 73 are active, while 125 have recovered. All positive cases recorded so far are asymptomatic cases. With the detection of COVID-19 positive cases in Mon district, Deputy Commissioner Tavasilanke has appealed to citizens to take all precautionary steps to mitigate the possible spread of COVID-19 for public health. In this regard, the DC has prohibited movement of public within 100-meter radius of the containment zone at Don Bosco School. This measure will come into force with immediate effect and shall remain in force till further orders. Anyone violating the aforesaid order will be liable for punishment under Section 188 of the Indian Penal Code. This news comes to you from All India Radio, Kohima. Nagaland Government has issued standard operating procedures (SOP) for special categories of people entering the state for urgent essential works or for unavoidable reasons. In a notification issued by Chief Secretary Demton Doy on 17th of this month, the SOP stated that in the case of government servants, both state and central intending to return or come back to the state, the permission will be obtained from the Home Department in advance, which, on being satisfied of the essential nature of the duties of the government servants, requiring them to immediately start functioning, will inform the concerned Deputy Commissioners and Chairman District Task Force. In the case of any person other than a government servant desirous to enter the state, the permission will be sought from the Deputy Commissioner and Chairman District Task Force of the destination district, mention the purpose of the visit and detailed itinerary, point of places to visit with date and time till the date of departure. Application for entry permit should be submitted at least 5 days before the intended date of travel. The Deputy Commissioner, on being satisfied of the urgency and unavailability of the visit, will submit with clear recommendation to the Home Department for seeking its clearance. On entering the state, the government servants will be subject to thermal screening along with other returnees to the state at a designated point of entry. Nagaland Governor has nominated Sentiyangar Imchand as the member of the Delimitation Commission in respect of Nagaland State. In a notification yesterday, Principal Secretary Home Abhijit Sinha informed that Sentiyangar will continue to serve as the member till the process of delimitation in respect of Nagaland State in terms of the Delimitation Act 2002 is completed. Prime Minister Narendra Modi will launch Garib Kalyan Rozgar Abhiyan tomorrow to boost livelihood opportunities in rural India. Modi will launch the campaign through video conference in the presence of Chief Minister and Deputy Chief Minister of Bihar. The campaign will be launched from Telihar village at Beldor block in Khagaria district of Bihar. It aims to provide livelihood opportunities to the returning migrant workers and rural citizens. Briefing media about the scheme, Finance Minister Nirmala Sitharaman said, Pradhan Mantri Garib Kalyan Rozgar Yojana, with an outlay of 50,000 crore rupees, will cover 116 districts in 6 states, namely Bihar, Jharkhand, Uttar Pradesh, Madhya Pradesh, Odisha, and Rajasthan. Odd-even system of vehicular movement will be initiated under Section 115 of the Motor Vehicle Act 1988 from 22nd of this month till 30th June. This odd-even system will apply to all areas within Kohima municipality except on 28th June. In an order issued today by Superintendent of Police Kohima, David Tutto Sophie informed that an odd-dated day, only vehicles with registration number ending with odd numbers will be allowed to ply. On even-dated day, only vehicles with registration number with even number will be allowed to ply. However, this system will not be applicable to emergency service vehicles belonging to police, administration, paramilitary, medical, fire services, SDRF, press, two-wheelers, trucks carrying emergency medical equipment, commodities, LPG cylinders, and interstate trucks carrying essential commodities bound for the state of Manipur. All vehicles restricted apply by virtue of government notifications shall remain enforced. The SP informed that violation of this restriction order will be liable to be penalized under Section 177 and 179 of MV Act 1988. Employees of government department are requested to take the staff bus instead of private vehicles during this period to help minimize traffic congestion. The SP further requested all citizens to abide by the restriction order and cooperate with the police on duty. And now 20 news, here are the main points again. Health Ministry issues advisory for healthcare workers managing COVID and non-COVID areas in hospitals. State Cabinet's meeting on the report of Tuensang fiasco remains inconclusive. COVID-19 recovery rate reached to 63% in Nagaland after 16 more negative tests. And Nagaland Government issues standard operating procedures for special categories of people entering Nagaland. That is all we have in this evening news bulletin. Good night.